Today we'll discuss blood in urine, 7 causes from the most harmless to the most dangerous. And as a urologist who sees patients every day, I can tell you why. Sometimes you should pay attention to it, sometimes you can relax, and sometimes you need to urgently see a specialist. If you watch this video until the end, you will know all the reasons why this can happen, even the most unexpected ones, which we will discuss at the very end of the video. Indeed, there are certain signals from the body that appear very rarely, but they change a person's attitude toward their own body. These include, for example, blood in the stool when it appears. I have a separate episode about this, and blood in the urine. This is also dangerous because all your life you get up, urinate, and your urine is clear. And suddenly today you got up and saw that along with your urine, at the beginning, at the end, or during the process, a large amount of blood comes out. Of course, the first reaction is usually thinking it'll go away on its own. Maybe I pressed something there, maybe I had sex in a wrong way, or maybe I drank something, so I'll probably just wait it out. Remember, urine should be clean, it should be clear, it should be, let's say, already filtered by our body. That is, it's a liquid that contains only waste products. And if for some reason blood suddenly gets into it, it means that something strange has happened in this system, which has been fine-tuned and has worked smoothly all your life. And in one case, it really is some kind of inflammation. Maybe something has ruptured somewhere, some vessel. And no matter how much we try to reassure ourselves with any everyday explanations, like I drank some juice, you need to know the main reasons why this can happen, and then there will be less anxiety, and you will have clear tools on how to act. Today, we'll review the main reasons this happens together. And along with all of this, for each reason, I will give you an action plan that will help you not to panic, but to understand what needs to be done, what went wrong, and how to move forward. Friends, the link to my free Telegram channel is below this video, where I share every day personally without any copywriters. I write the text myself with my own hands, which will change your life for the better. About proper nutrition, about good habits, about the right medicine, about proper scientific research. By reading this and spending just 30 seconds a day, you can become a better version of yourself every day. The first reason is rare in men. It's a female ailment, acute cystitis, an inflammation that is felt immediately, blood in the urine, and it's a fairly classic picture. Sharp urges, burning, stinging, a constant feeling of irritation. This happens quite rarely, meaning cystitis doesn't develop over 3 to 4 weeks. It suddenly appears in the evening after getting cold or after sex, and urination becomes painful, very painful and unpleasant. But sometimes there can be painless hematuria, and with all this, most often blood may appear depending on the severity. Sometimes it's almost pure blood, but usually it comes at the end of urination. It can be just a couple of drops and the blood is slightly colored when the neck of the bladder closes. But the real reason why blood appears in the urine is the inflamed mucous membrane. When it becomes inflamed, since it is filled with blood vessels, it becomes loose and sensitive. These vessels on the surface can rupture and cause bleeding. And when a woman sees this, she gets very scared, especially if it's the first time in her life. But I'll say right away that this is usually accompanied by pain, while cancerous conditions, or what we call cystitis, meaning it looks like cystitis clinically, don't cause pain. It often happens that a tumor bleeds, but there is no pain. Things like that are probably more concerning than when you have sharp pain, so if it hurts and there's blood, it's actually not that scary. Why does this happen? Because the body expels bacteria, it protects its mucous membrane, it activates the immune response, and in the mucous membrane wall, our immune system fights the bacteria. And after drinking, it's the mucous membrane, and unfortunately, it just gets damaged. What you need to do is get a urine test, do a urine culture, establish a proper drinking regimen, and drink more to flush everything out faster. And of course, the only way to recover is to take antibiotics that will kill the bacteria, but only based on the test results. For example, medications like Manural can be taken once blindly because very often the source is E. coli, Escherichia coli. But it is still recommended to find out which bacteria got into the bladder, multiplied, and caused this inflammation. Treating blindly, imagine you have to treat blindly for 2 weeks, 1.5 weeks, and if you miss the sensitivity, the cystitis remains as it was. You also made this bacteria even stronger, harmed your body and your liver by taking antibiotics, developed dysbiosis, and after 2 weeks the cystitis came back again. So during this time it bothered you a little less because your immune system is also fighting these infections. That's why we do a culture. This is a urine test where you'll get the results and they'll tell you which bacteria it is, in what concentration, and which antibiotics are effective against it. this one doesn't work, this one doesn't work, this one doesn't work very well, but this one works great. And you should take the one that is most effective against it. Only then can you fully cure it so that the illness doesn't come back. Hello, friends. I want to remind you that I have Ipsum vitamins, which I created with love, first of all for my family, for my friends, and now for my child as well. Because soon, maybe by the time this video is out, there will also be a children's line and sports nutrition, which I also plan to make. I try to choose the best raw materials, use the best production technologies, and at my own factory, which is located in a special economic zone in Dubna. I make vitamins for you that I am proud of and for which I stand by my reputation. That's why my last name and signature are on every bottle. Friends, thank you for your trust. Thank you for the tens of thousands of positive reviews, for the ratings you give our vitamins, and for believing and trusting in us. The most important thing, the greatest value in my life for me is your health. Be happy. The link to the vitamins is below this video. The second reason is kidney stones. This is something I have dealt with all my life before I started actively working in oncology. Believe me, you can't mistake this pain for anything else. If you've ever passed a stone, if you've ever had a kidney colic, you'll know exactly what it is, because there's a particular feature, whether you lie on your right side, your left side, or even run on the ceiling. The pain is always there, you can't mistake it for anything else, and there's no body position that will make it much easier for you. Why does blood appear during a colic? Because the stone is very rarely as smooth as a pearl. It always has spikes, it's sharp, and as it moves, it can injure the mucous membrane. And that's why if we see blood here, most often it's a sign of mechanical damage, meaning the stone passed through, scratched, and blood appeared. Why is this important? And by the way, why is it important to understand that blood and colic are connected? It's related to the kidney, usually the lower back hurts, and it's not connected to movement. If it suddenly hurts to bend over, turn, or twist, or if it gets easier in a certain position, that's not the kidney. The kidney doesn't care about that. If the outflow from it is blocked because of a stone, it doesn't matter what position you're in, because often blood appears and your lower back hurts, but the cause of the pain is that you caught a draft and the blood is coming for a completely different reason. That's why a stone can really get stuck. It can become a plug in the ureter because the kidney's collecting system to expand and the kidney becomes like a small blimp. This is called hydronephrosis. And naturally, where there's a stone, there's often an infection as well. And remember, a blocked kidney with infected urine is a very dangerous situation. What should you do in this case? You need to check if the kidney outflow is blocked by the stone, but remember, the blockage could have another cause. It could be some kind of tumor in the kidney, it started bleeding, and all of this turned into a clot. And a clot. When it moves through the ureter, it causes you pain, meaning pain in the lower back, even if it appears suddenly. Sometimes it can be a clot or a bleeding tumor. So what's the first thing to do? It's something that's easy to do, quick, accessible, inexpensive, and without any consequences for the body. That's an ultrasound. Do an ultrasound of the kidneys, the ureter if you can reach it, because only the upper third is normally visible, and for the very lower part, computed tomography scan is the gold standard. If we're looking for a stone, the first thing they do is a computed tomography scan without contrast, and then they add contrast. The computed tomography scan will help determine if there's a stone and where it's located. There are also some pitfalls there, because in the lower parts of the ureter, where there are different vessels around, it's often actually in the walls of the vessels themselves. There are calcified plaques, and on a regular X-ray without contrast, you'll never be able to tell which one is a plaque, where the ureter is, and differential diagnosis is needed. The third reason why urine can become colored with blood is a cold or a viral infection. In that case, it may be macrohematuria, visible to the naked eye, or sometimes microhematuria. That is, you went and took a routine test, and they tell you that you have blood in your urine. You can't see it with the naked eye, but it's there. This is called microhematuria. There are situations when blood appears in the urine after, for example, intense exercise, that can happen too, or after prolonged dehydration, which can also happen. This is called transient hematuria. That is, it's a temporary phenomenon, a kind of transit, when the blood vessels become more fragile, when the pressure in the glomeruli increases. For instance, after a jeep tour like I once took, your side might start hurting, apparently because a small stone or something came out. It's relatively safe, but only if it's a one-time occurrence, meaning it happened once and you forgot about it, like, okay, fine. In all other cases, I recommend repeating the urine test, even if you don't see anything with the naked eye. Definitely in 2 to 3 days, if everything is clear, the issue is resolved. The fourth reason is prostatitis, inflammation of the prostate gland. Why? Because this is a common problem among modern men. It causes various symptoms, including pain sometimes in the groin, sometimes in the perineum. Sometimes because of this, there are problems with erectile function, and sometimes it hurts to urinate. And prostatitis has a huge number of symptoms. and acute prostatitis can actually be accompanied by blood in the urine. When we perform a cystoscopy and go through the prostate into the bladder, we see the prostate from the inside. And there can be a huge number of vessels there, really altered, like varicose nodes, especially if you have some kind of adenoma, and indeed, especially in middle-aged men, against the background of heavy physical exertion. You did squats with a barbell, especially with a heavy lifting belt, had sex, then had sex again. The blood vessels really sometimes can't handle it. They can become inflamed, the prostate can swell, and the swelling that occurs disrupts the normal flow of urine because the prostate compresses and narrows the urethra, causing small microcracks to appear. This especially happens when it's hard for you to urinate after sex, and you force the urine out to empty your bladder faster. I don't recommend doing this after sex. It's better to wait until you can urinate comfortably. Associated symptoms are heaviness in the perineum, pain, frequent urges, decreased urine stream, and fever. So, what should you do in this case? Of course, any specialist would probably recommend a urine test. As you already understand, the most common mistake after which people come running in with wide eyes is when they go and get a prostate-specific antigen tumor marker blood test. That's prostate-specific antigen. They come to the lab and ask what test can check their prostate because something is bothering them. They are told, well, here's a urine test, prostate-specific antigen and so on, but they aren't told that under no circumstances should you take a prostate-specific antigen test after sex, after a rectal exam, or during inflammation. As a result, a 35-year-old guy comes running in and says, my tumor marker is 5 times higher than normal, what should I do? He's already read that he needs to get in magnetic resonance imaging. He's already starting to write his will. In reality, you just need to retake the tumor marker test in 2 to 3 weeks when there's no inflammation, and everything will be fine. So remember, we don't take a prostate-specific antigen test during inflammation. Under no circumstances should you take a prostate-specific antigen test during inflammation. We get a prostate ultrasound, take the results to the urologist, and he prescribes treatment since prostatitis is a urological issue. In one case, it's antibiotics and suppositories. In another case, it's just sexual rest and nothing more. And in a third case, if it leads to urinary retention or residual urine, sometimes it requires full hospital treatment and admission. The fifth reason is when the blood comes from our main filter, from the kidneys, from the main filter. Most often, this is glomerulonephritis. It's an unpleasant disease, to be honest. It very rarely happens just once and then leaves a person. It often stays with them. This is a very important condition that should not be missed. If the blood in the urine is cloudy, dark, and looks like tea with milk, urologists' favorite term for this is the color of meat slops, which easily explains what color this urine is. So usually there's no pain, no burning sensation. That means we immediately understand that this isn't a colic, it's not a stone passing, and it's not cystitis. That it's painful to urinate, but there's blood in the urine, and painless hematuria, when there's blood in the urine without pain, is a dangerous condition. But in the case of a tumor, the blood usually gives a strong color, while with glomerulonephritis, the urine usually has only a very faint color. This term, meat slops, describes it very well. The problem isn't in the bladder or the prostate, but in the glomerular filter, which is the blood filtration system in our kidney. And actually, it's not urologists who treat this, even though everyone thinks that any kidney disease is treated by urologists. No, it's nephrologists who treat this. The cause is an autoimmune reaction. It can be some kind of bacterial contamination, or it can be a reaction to certain medications. Very often, for example, what we saw with COVID, glomerulonephritis could develop. You need to do a regular urine test. A daily urine test is not enough. I would also recommend a blood test for creatinine. Be sure to check the glomerular filtration rate. It will give a very good idea of the condition of the kidneys. Check the protein level because the kidneys often start to let protein through and you lose protein. Your blood protein level may drop and protein may appear in your urine. There are several immunological tests and you need a consultation, but not with a urologist, as that would waste time. If there is no mechanical problem, urologists are like plumbers who deal with mechanics. For everything else, go to a nephrologist. That's why it's important to understand that glomerular nephritis is a condition you can't just ignore or wait out, hoping it will go away on its own. This is a condition that requires serious treatment, a serious approach, and sometimes the prescription of hormonal medications. And very often this disease comes back. The sixth unpleasant thing, but it can't be ignored. The cause is bladder tumors, which is quite a silent cause. At the same time, this source of blood is very insidious. This is the reason nobody wants to think about, nobody naturally thinks about it. When blood appears in your urine, it's the last thing you want to think about. But unfortunately, one day this can happen to someone. It is painless hematuria, meaning blood in the urine without pain, that is the most dangerous but also the earliest sign of a bladder tumor, or a tumor, for example, in the renal pelvis or ureter. But usually, when there is bleeding from the kidney, there is a feature that all urologists know about, A clot that passes through the ureter often forms in the shape of vermicelli or macaroni, a worm-like clot. We ask the patient about this. Describe the clot. If he says, I was bleeding and I had clots, they were worm-like, we definitely need to examine the upper urinary tract because the kidneys could be the source. Some patients had a cystoscopy, were told everything was clear, went home, yet still had a tumor in the kidney. What should you do if there is blood in the urine, painless hematuria? A cystoscopy is absolutely necessary, which is done with a special camera. Entering the bladder and examining it is unpleasant, but for men, this is most often done under anesthesia. Because our urethra is longer and less convenient, while in women it is shorter, and for women this can be done under local anesthesia almost painlessly. But this is the best method, which saves lives. Because when we detect a tumor at the first stage, imagine it's just a centimeter, we remove it along with a small part of the bladder wall, and that's it. With a high probability, everything will be fine. But if you let it progress and it manages to grow into the muscle layer, then the bladder will have to be removed. Probably that's when there is the most disappointment, the most negativity towards yourself. Even though I save people's lives, I feel this way when I remove the bladder. Yes, I create a new one from the intestine, but when a person leaves me, let's say, without a kidney but healthy, that's one situation. They live a full life. But when a person, yes, I saved their life, but they leave me without a bladder, with a stoma that they will have to carry on their abdominal wall for the rest of their life. And I don't feel any moral blow or satisfaction. Reason number 7 is kidney cancer. Very often, all of this happens without symptoms, except for one. As you already know, a kidney tumor has 3 classic signs. Those who watch my videos understand, and if even one of them appears, that's also a very alarming sign. And at the very early stage, the only symptom is blood in the urine, sometimes barely noticeable, just a couple of drops maybe, and sometimes with clots, as I already explained to you, worm-like in shape. A kidney tumor, if we imagine that a fist is the kidney, meaning the flesh, so to speak, the parenchyma, and then there's the collecting system, which is where urine collects, and if it's a tumor of the parenchyma, the flesh, even at the 3rd or 4th stage, there is often no bleeding, but it's the tumors of the renal pelvis that bleed, which is why there is such a discrepancy. Very often, when you treat people, when we as doctors treat them, we don't see blood in the urine. Blood in the urine usually only happens with tumors of the renal pelvis. So remember, if there is blood in the urine without pain, without fever, without frequent urges, and this is a recurring issue, you must rule out, especially if there are worm-like clots from the upper urinary tract. What should you do? Of course, you should definitely start with an ultrasound, again, because it's usually readily available. It's simple, easy, and quick. The next step is a computed tomography scan with contrast, but you need a biochemistry blood test first to check for contraindications. If you have high creatinine, a computed tomography scan with contrast can cause complications, so don't worry. Because kidney cancer at an early stage is treated quite effectively today with surgery, and in the vast majority of cases without consequences for your body. Yes, in some cases the kidney has to be removed, but after that you live a full life. Even with one kidney, when a person lives with one kidney, there are practically no restrictions. Well, I probably wouldn't recommend engaging in certain contact martial arts where you could physically injure that kidney. Other than that, basically there are no restrictions on diet, not even on alcohol. What should you do? Still, let's say you went to the bathroom in the morning and saw that your urine had blood in it. The first thing is to confirm that it really is blood. Sometimes there are foods you forgot you ate yesterday that can color your urine. That's beetroot, for example, or B vitamins. But if your urine is pink, red, or brownish, then most likely it's blood. The second step is a quick set of tests. Really, the second step is laboratory diagnostics. That's a general urine analysis. The simplest thing you can do if it really is blood is you'll see red blood cells, and that will be described. You can also do a Nechiporenko urine test. It's a bit different, a general blood test, C-reactive protein, also called C-reactive protein. It's an indicator of inflammation in the body. Third, don't overestimate kidney function with urea or prostate-specific antigen in men, only if there is no acute inflammation. A rectal exam is even a contraindication before taking a prostate-specific antigen test. Step number 3 is an ultrasound screening. We always perform a full urology screening, including kidneys, bladder, and for men, the prostate, even if we suspect only bladder issues. Once patients come in, a complete check is needed. The presence of one illness does not rule out another. We've had patients who had 3 tumor formations at the same time. He came in for his bladder, but also had a left adrenal issue and a right kidney mass, so we say, please do everything. An ultrasound, which is done quickly and painlessly, helps to rule out most of the dangerous causes, and you can at least calm down right away. They'll tell you, for example, that your kidney is swollen, there's a stone passing, and at least then, as they say, you can move on more relaxed. And the fourth step is, if blood in the urine appears again, to move on to a deeper, more thorough diagnosis if the first line of diagnostics didn't reveal the root cause. Here, I might include magnetic resonance imaging, but for kidneys we usually prefer a computed tomography scan. Magnetic resonance imaging is mainly used for other purposes. If we're interested in the bladder, prostate or kidneys, we use a computed tomography scan with contrast, and it's essential to do a biochemistry test beforehand to check our creatinine levels. Cystoscopy is the most unpleasant and used only as a last resort. In surgery, it's always an instrumental procedure, and medicine prioritizes less invasive methods first. If bladder cancer is suspected, that's when magnetic resonance imaging or ultrasound has already shown something or hasn't shown anything and you don't understand the source. In such cases, it's absolutely necessary to check and look at the urine culture. We also went over this together, and you understood in which cases this needs to be done before a procedure like cystoscopy. This is essential to prevent complications from any infection, and there are also some nephrological tests. If the urine is tea-colored, I still recommend first consulting a nephrologist so that they can select an individual approach. When it's necessary to drop everything and rush in. That is, when there is blood with clots, regardless of whether the clots are worm-like or regular, you should always go straight to the doctor and not try to self-medicate. Second, when there is colic. If it's a small stone, it'll pass naturally and be fine, but a larger centimeter-sized stone can get stuck in the ureter and won't come out by itself. This can cause acute obstructive pyelonephritis, especially if pain with fever signals the condition has developed. If you have blood and a fever, see a doctor right away, especially if there's blood. A sudden worsening of your condition, especially with low blood pressure or chills, indicates serious bleeding. It often happens that a man comes in and imagine he had bleeding at night, then in the morning he gets up and says he can't urinate but feels weak and sweaty. It turns out he was bleeding all night. The entire ureter and renal pelvis are clogged with clots, and there's already a clot of about 600 to 700 milliliters in the bladder. And he can't urinate because this clot has already coagulated and simply can't come out of the bladder. That's why, for men over 45, even if blood appears just once, you definitely need to pay attention to it. Painless hematuria is also especially important. We should go to the doctor right away, even if we don't feel any pain. Blood and a weak urine stream could possibly indicate acute prostatitis. And then it can progress, for example, to fever and even up to a prostate abscess. So blood in the urine and a weakened urine stream. Let's go to the doctor. The sixth step is to follow the basic rules during diagnosis. Don't forget or break them. First, maintain proper hydration. Second, no alcohol. And third, absolutely do not forget, no self-medicating with antibiotics. Another important point regarding hydration, especially if you're bleeding, why is it so important to drink a lot? Because the clots that form in the bladder, if you dilute and dissolve that blood with a larger volume of urine, everything will be okay. The main issue is drinking too little, which leaves mostly blood in the bladder that can clot. As a result, you'll need an emergency cystoscopy to wash out those clots because you weren't able to flush them out in time. So don't be afraid if you see blood in your urine. Now you have at least some action algorithms, and as they say, you're armed with information. To be continued.